Welcome to this episode of the Big Unlock podcast. It was started by, a dear friend, Paddy Padmanabhan, and of Demo Consulting. And I am actually carrying on Paddy's legacy with these podcasts. So Paddy had done 140 of these, believe it or not, and
Oh, nice.
I did the 141st one with one of my Harvard Medical School colleagues by the name of NJ, and today we are talking about the 142nd one with you,
Oh,
Vineela. So
privileged.
yeah, thank you. So would you like to start with a quick introduction, and then I'll introduce myself as well, and then we can get into some nice discussions.
Yeah, sure. I'm Vineela Yannamreddy, Chief Information Officer for United Medical Center, which is also known as Not-for-Profit Hospital Corporation in Washington, D.C.
That's great. So how long have you been there, Vineela?
It's almost 6 years.
6 years now. Okay, great. So I'm Rohit Mahajan. I'm now the managing partner and CEO of Demo Consulting.
Mhm.
So what I would like to ask you, Vineela, is that what interests you in the healthcare industry segment to become the CIO of a hospital system like you have at the United Medical Center in DC?
Yeah. So I got to tell you a small story where it all began.
Yeah,
Right about when I was in seventh or eighth grade, my grandfather was diagnosed with some blood clots in his brain, and we were seeking for, um, a lot of treatments back in India. And some of them were not diagnosed at that point of time, and this was way around 30 years back or something. And back then the MRI technology or the CT technology was not so advanced as it is right now.
mhm,
And because of that, it was, missed, and he could have lived longer.
yeah.
And because I'm very much attached to my family, and that was the first, I think, the most saddest thing that I ever saw in the whole family. And that's when I decided that, okay, I think I need to get into this technology field where we could, help the clinical world and help a lot of people. So that's where it all began, and I pursued my biomedical engineering from JNTU, one of the colleges in JNTU in
Great.
India. And then I pursued my master's in biomedical informatics from Rutgers School of Health Professions.
New Jersey.
That's true.
Awesome. Awesome. So how long, Vineela, have you been in the leadership position at this hospital system, and where is it located, and what kind of population does it serve?
So I've been in this leadership position about 6 years.
Great.
I joined as a director, and then I'm a CIO. And this hospital is located east of the Anacostia River in DC, wards 7 and 8. And we currently serve 200,000 residents in our primary focus area, and then about 2 million of our secondary uh, population area.
So it's a pretty big population, is it? Do you find it very diverse in terms of the population over there?
Yeah, it's not very diverse, but we do serve a majority of Medicaid patients at our facility.
That's good to know. So while you have been there many years, Vineela, you have done a lot of work from technology perspective to obviously support the business needs of the hospital. You've done, over 200 applications, and you've kind of transformed the EMR system over there as well. So could you would you like to share with the audience on what are some of the thought process that drove those changes, and what were some of those changes that you were able to implement successfully?
Yeah. Upon my arrival, the hospital underwent, many management changes. Believe it or not, like every year there was a new management. So it has been a very rough road for the hospital and the population it serves. And there were about 50 projects that were on hold or in progress that, because of the changes in the leadership,
Yeah.
every team would want to pursue projects in a certain way. So with that being said, there were many hanging there without reaching its completion phase. And some of them were like, they could not be integrated with our EMR. Since the hospital is so old, the EMR or the applications are very old as well. They're legacy systems where, the new technology wouldn't, they are not compatible for integrations. So what we had to do is that we had to determine, the overall goal for the management that I was in, and to prioritize all the projects that would immediately give significant success to the management team. And I learned it somewhere that where they say, these type of arrangement, the silo ITs, where every department would purchase their own application without consulting the centralized IT, and they would want to just either implement it, or there are many web-based applications, so people, the departments can procure themselves, and they can start
Yeah.
using putting the information everywhere, and all those sorts of things. So what we did was we worked closely with all the leaders, and not only with the leaders, but the stakeholders, the end users themselves. Because at that time, the leaders also didn't have, the complete picture of what was happening in their department. So we had to collectively form a task force, and we had to reconcile all applications
Yes.
from every department. And we reached out to every single end user, know their workflow, and prioritize these projects that were on hold or in progress. And we tightened up all role-based access and worked on all data sharing mechanisms. The next step was to revise old and the ongoing policies, and implement any new if we thought we needed one, and got our security risk analysis done, because of the plethora of applications we had. We had
Yeah.
to get an external entity, get everything done, and fix up our security issues. And earlier I mentioned about some projects that were in progress, but we couldn't attain completion, right? So as they couldn't be integrated further in our EMR, for those we put together creative heads and created or built the bridge solutions, because the ones in the market won't, are not compatible with this one. So we worked up different kinds of solutions to bring, something functionable. And once what we thought at that time would be standardized and customized for our hospital is what we did at that time.
That's pretty significant achievement to bridge the gap across a very diverse set of applications and technologies, and be able to bring all the stakeholders together. So you are well now on your journey of digital transformation, and that means various things to various people. I would like to ask you that what do you think about your digital transformation efforts, and if you could describe a few of them which have had impact on the patient population. And I also understand that we are very fortunate at Demo Consulting that you have completed the digital
Yeah.
maturity assessment, and thank you for that. So I
No,
hope.
thank you, because I found it very useful to measure against our peers, or basically the industry standards, to see if we were on the right path or not. So that is, the self-check is always important.
That's great to know. So, and obviously, as you know, we'll be coming back to you with the results,
Mhm.
and we'll be announcing some, awards and winners as well in various categories. But Vineela, please describe in your own, way that what is digital transformation for provider systems such as yours? Where do you see it going? Some of the challenges that you might have faced, and how did it actually end up impacting patients?
Yeah. So again, I would like to go back to the point where I started here because there's something like there are morning huddles, there are afternoon huddles, there are interdisciplinary action, a lot of things going on in the hospital, so which every hospital has it. So in the morning, when I attended my first interdisciplinary meeting over here, um, the meeting was ran by that shift supervisor, and they were presenting all the numbers to the team who attended the huddle. And again, I noticed them jotting down all those numbers in a book, and then thereby emailing those numbers to a bigger group after some time. And then this continued for the second day, the third day. And then I couldn't stop myself asking the whole team, how are you going to analyze this data, and how are you going to make some informed decisions, or how are you going to predict something if you're going this way? So I don't mean to criticize the way how it was done, but they were doing the best at that time with what they had, and how they had to go with all the changes that were happening for in the hospital. So that day we just decided, and I had a huge support from each and every one over here. I presented the idea, and it is not new because rest of the world was already on it. Is to have live dashboards, robust and advanced data analytics. And again, this is the biggest challenge because we were using so many island applications and a legacy EMR. Again, the readily available market tools were not going to work for us. So we had to customize and build our own analytics platform. So we put together all our skills and people, and we built our own analytics platform. And
That's
it
great to know.
took us about a year and a half, but we were really into it. And I saw that hunger in all the physicians because they wanted to do informed decisions, and the leadership too. So we were able to get that. And since we have, we now have analytics throughout the hospital, providing real-time updates, alerts, and on-demand information, enhancing the patient care and operational efficiency. So every department relies on it.
That's a very, very compelling story, in the sense that you were able to bring everybody along. And that was leading to my next thought, to discuss with you, that how did you manage to change the mindset of the people, or how did they manage to change themselves to adapt to this new world, where technology, especially now we are talking about, and I'm sure both of us will get into it, on AI and Gen AI and other new technologies which are coming our way. How do you change mindsets and change behaviors and change culture over there?
I'm sure changing cultures, changing behaviors is very challenging. It's
Yeah.
challenging, time consuming, but I must say that the leaders and the directors, everyone, uh, they were envisioning the goals of the hospital, what we should do. But the only thing they were not having is how to approach. And that's where my specialty, my expertise comes from, because my specialization is in EMR. My specialization is in healthcare applications. So I bring that expertise in here. I did have a lot of cooperation, but I know there were some delays, but when we have the proper planning and when we can visualize what the big picture is and just envision them and show them some samples of how it would look like, then it would be really easy.
That is good to know. Yeah. So of course, if you can show something to someone, your picture is worth 1,000 words, as they
Mm-hmm.
say. So I can completely understand that. So would you like to provide, one example of how these technologies which you were implementing and you continue to be implementing in your hospital system are accessible and usable by a wide variety of users and a diverse population, including within the hospital and outside the hospital in terms of patients as well, right?
Yeah. So my focus always has been to identify and prioritize critical technology needs for immediate applications that can bring significant, benefits to the hospital. Hospital meaning both. I have my clinicians and patients, both. I give them equal weightage. The more clinicians can spend time with the patients is the more better for us. So right now, with all these regulations, I know the clinicians are always complaining about the more time they spend on documentation, going into n different types of applications than, being there with the patient. So I try to gauge myself or my team's uh, evaluation in how much time we can, give it back to the clinician so they can go and
That's a great
deal
measure. That's a
with the
great measure.
patients.
Yeah.
Yeah, so I always look forward for that, and I hope all our clinicians are can vouch for that. So basically, balancing the need and preparing the staff is crucial. So we develop clear strategy, meaning
Mhm.
outlining the goals, timelines, expected outcomes. That I put more time into that because I know the team has the skills. We have a small notion in our team is like we do whatever it takes
That's
to get
great.
the outcome. We do whatever it takes. So we learn, we are the whole team is very open-minded. It's not that okay, your role is this, you are going to do only, you're going to sit there and just do this. No. We cross-train ourselves. We are continuous learners. And I myself, I enroll into a number of courses that I can't even finish, but I keep learning. So I keep my team encouraging, to do the same thing.
That's
So
great.
again, we assess the current skill set, identify the areas that are, that require improvement. We provide training. If we require specialized skill set, we always have the option to hire, that particular, if we have a dire need, we can, always hire those seasoned professionals. Again, we prioritize user-friendly designs, making it easier for the users to adopt. Again, our main focus is end users. How can we improve their workflow? You know,
Makes
always,
sense.
and one of the
Yeah.
most important items that we have implemented is robust change management system. What
Hmm.
is the current workflow, and what are the changes that we are going to bring it, and how is it going to impact? Is it simplifying it? Is it making it complex? If anywhere we think it is making complex, we just cut back because it's not worth it. We
That's
all
true.
try to simplify the end users workflow.
That's amazing that you are able to achieve so many milestones. Moving on, what I would like to talk, Vineela, about your thoughts on two things of obviously new and upcoming technologies like AI and Gen AI, of course. But before that, how do you do innovation? Like, how do you innovate? Do you involve external parties? Do you have some kind of a innovation focus department, or is it part and parcel of everybody's, kind of like daily life?
So I think one thing that we have implemented is to have IT steering committee
Mm-hmm.
where the main idea to address two main things. One is I am always in contact with the C-suite leaders, the directors, the managers, and make sure that I am aware of all their application needs. That's
Mm-hmm.
one thing. And the IT steering committee, what it does is whichever department wants to, let's say I'll just give you an example. The anesthesia department wants to, go completely electronic, and they bring up an application and say, hey, I picked that because some of the anesthesiologists have, experience in one application and they would want to go into that. And if they bring that to the table, we have a formal request process, the project request process, where they have to enlist all their requirements. They can bring, some technical specifications as well. And as a whole team, the entire hospital, all the leaders will look into that requisition and decide, and they will vote on to move further or not, because based on the budget as well, we will the group will decide, okay, we have this budget, what is our dire need? So
Right.
prioritization happens at that level.
That's
And
great.
then once we all agree that, okay, this department needs this application, the C-suite level work is already done. Once the budget and that is done, we go to the stakeholders, the end users, because up above, they may have the overall idea, but day-to-day activities, I am 100% sure, even not me, will have that kind of hands-on experience. But what I would love to do, and always have implemented this, is to go back to the end user. We observe. It's not only just, you're somewhere 1,000 miles away and we don't know what's physically happening. We observe their workflow, physical workflow. We calculate, we take into the account the amount of time the complete workflow happens, and then how putting this application can enhance not only digital, but their day-to-day activities as well. So
Great.
that level of thinking, thought process is put into. Um,
So there seems to be definitely, a robust thought process on how innovation can be achieved in your environment.
mhm.
That's very good to know, Vineela. And now moving on to AI and Gen AI, what are your thoughts on these new technologies, especially Gen AI? Have you been experimenting with any predictive analytics or large language models? And what would be your advice or thoughts to any other healthcare leaders on how to go about this journey of exploration?
So yeah, AI and advanced analytics are indeed shaping the future of care delivery and treatment plans. There's several ways in which these technologies are making significant impacts, such as personalized medicine. By analyzing vast amount of data, this allows for development of personalized treatment plans tailored to the individual patients. Again, predictive analytics for disease prevention. That's the most thing that we use over here. By analyzing historical patient data and patterns, the algorithms can predict the likelihood of certain diseases or the health events way ahead of time. So definitely that's one thing that helps lowering the healthcare costs. Um, Again, one thing I always look towards is the efficient resource allocation. Advanced analytics can optimize resource allocation within healthcare organizations by analyzing patient flow, bed occupancy, and staffing schedules. So definitely that's one way to reduce wait times and improve overall patient experience. Um, Again, everyone knows remote patient monitoring, telehealth with all this COVID pandemic. We are so much into the telemedicine now.
Yeah.
Again, AI-driven analytics enable continuous remote monitoring of patients with chronic conditions. This allows healthcare providers to detect early signs of deterioration, intervene promptly, and adjust treatment plans without the need of the frequent visits. Uh, One thing I was also looking into was fraud detection and prevention, where you can use AI algorithms in analyzing the claims data, identifying patterns indicating of fraudulent
Yes.
activities in the healthcare billing. Not only these, but AI and advanced analytics are also utilized for population health management, clinical trials, natural language processing for data extraction, enhanced imaging, and the analysis, reducing costs and contributing to more patient-centric and proactive approach to the healthcare. Um,
Right. So lots of uses and applications of all these new technologies. So as they say, hindsight is always 2020. So standing here now and looking back, if you were able to go back and change one thing, Vanilla, or whatever, two things, what comes to mind? What would you like to do differently or have done differently?
so not differently, but one best examples in the recent times, again, I just said about the COVID-19 pandemic. Our patients and clinicians definitely stepped up and went full scale on telemedicine for their care. They needed not only we were trying to expand telemedicine back then, but we had the adaptation issues from both clinicians and patients. So, using telemedicine over the traditional methods, just like the saying goes, necessity is the mother of invention. Definitely COVID pandemic brought that into a different kind of reality. Since our telemedicine platform was ready, uh, embedded in our AMR with minimal infrastructure, we were able to serve our patients. So it has, been a tremendous collaborative work from both our physicians and the patients to utilize the digital platforms. The only thing I am working towards, the whole team is working towards, is given the population, just as I described earlier, we are trying to implement a tech bar where, when the patients are in the waiting room, we would try to educate them about, the uses of
Oh,
uh,
that's interesting.
yes, the uses of,
Yeah.
how you can get to your patient portal, how you can, look up your summary, how you can. We already do that education right now when, upon registration, we do give them
Mhm.
all that information. But we
Yes.
want to take one step ahead and see, while they are waiting, there's help available. If they're, we encourage them to try to encourage them to tell them the advancements of digital transformations and how this can help them better. Uh,
Yeah, I think that's a wonderful idea because everyone's sitting there doing nothing in the waiting room. And
yeah.
if you have a tech bar like you're describing, and it's almost like a help desk and you can help
Mhm.
the patients during that time, that's wonderful.
Yeah, we do
So when
have the help desk for our employees, like
yes.
our response time, especially we have like an internal communication system, which we have
Mhm.
implemented within all of these projects as well.
Mhm.
It's tremendous. The response times, to me, if you text me in that, my response time is 2 seconds.
Oh, wow.
So
Okay.
that's how we have, come from very far away to this, where we where we try to cater to the patient's needs.
That's awesome. So I think that brings us to the great conclusion of this interaction. I would like to thank you for participating, Vineela, on this podcast, and also on the DGM assessments and the awards. And I would like to end, obviously, by making a plug for Demo Consulting, a new a service offering which we have just launched in the market. It is live on our website. So we are going to be offering Gen AI workshops for the C-suite, and these will be available to our clients and potential clients to be done in person at their site, so that they can bring their C-suite together on this wonderful new technology. So with that, I would like to ask you if there's anything else you would like to say in conclusion. And
That's
good luck.
fantastic.
Yeah.
I think um, companies like yours should definitely bring the technology together for the C-suite leaders, because the reality is completely different. While the technology is developing at a super fast paced in the outside world, but what happens in reality in hospital is completely different. There
Yes.
are different day to day, minute to minute challenges that the teams face, and it's good for companies like you are putting together uh, educational courses like this. Uh, and yeah, I'm
Yes.
very, very glad to be a part of it.
Oh, thank you so much.